Hello, everybody. Thank you for joining us. Chris Miranda, your host. I'm a licensed acupuncturist and massage therapist in the state of New York. I have companies as the Acupuncture Being, Acusage Therapy, and my new one is NYC Studios. It's a PLLC. We're here at Help with Your Health, and I have a very special guest with me today. Dr. Bernard Katz. He's a psychologist. He's a clinical psychologist, correct? And he's top of his field. He actually is the author of a book. It's called "Actually, It Is Your Parents' Fault." So, and we kept up continuity with certain cases, and I'm a fan of him. So, without further ado, is Dr. Bernard Katz. Hello, how are you?
Good, Chris. How you doing?
Very good. Today's topic, I actually want to talk to you about, from your perspective as well as mine, is depression.
Mm-hmm.
Now, I know you see, dozens upon dozens of these cases, right? I actually get probably about a handful a year of this, of dealing with anybody who has been dealing with depression. And I treat it from a Eastern Asian medical perspective with acupuncture or herbs. It doesn't work for everybody as far as with certain types of points or the herbs. So I have to kind of utilize with what I have and the person that I'm actually dealing with. I do get success with it. Just sometimes it's just trial and error. However, with you, with the people, the people of your, with your caliber, and the people that you actually bring in and work with, a big advocate for talk therapy, utilizing, bringing things to the surface. But what I actually want to ask you is, when you have somebody who comes in, and do they tell you they're dealing with depression? Do they know exactly what it is, that it's actually depression they're dealing with, firsthand? Or do you have to kind of get them to see it, realize it, understand it?
Many people do come in and they're suffering from depression. They feel sad. They feel helpless. They feel their lives are out of control. They feel pessimistic. They have difficulty eating and sleeping. So the signs of depression are clear. Within that, there are mild depressions, moderate depressions, and very severe depressions, and you might treat them differently. Then you have people who are depressed who, quote, don't know it. They're generally fatigued all the time, and blood tests and blood work shows absolutely nothing. They have other somatic things. They have stomach pains, they have back pains, etc. Their relationships are no longer filled with any kind of vitality. So there is an underlying depressive affect to many people. So they come in here because there's a relationship issue, or there's a relationship with a loss in their life, or there's a relationship issue at work. So they're depressed, but they don't know it. And part of the work with people like that is getting to the depression, bringing it to the surface, getting the person to understand that they're depressed, and then to work with it so that the depression fades.
Categorize it so much?
No. Depression cuts across all of these kinds of things, principally because depression is very much connected to loss. And it doesn't matter how old you are, and it doesn't matter what your race, ethnic identity is, etc. If relationships end, if you mentioned the title of my book, Actually, It Is Your Parents' Fault. The subtitle is Why Your Romantic Relationship Isn't Working and How to Fix It. And I will tell you that most depressions occur in relationships that are failing. Whether the person is married, whether they're going together, whether they're living together, when a relationship is failing, becomes conflicted, and even terminates, that's one of the major sources of people being depressed.
Now, you said loss. Would you really say it's emotional tied to grief?
Grief is a form of depression. So if you lose somebody by virtue of death, we will assume, could be a parent, could be a spouse, could be a lot of things, what happens is you grieve. You feel depressed, you feel sad, you feel non-functional, the things I was talking about.
Also, I wanted to actually, how do you track? because for me, I can actually see the results. I could see how people are before and after with acupuncture, because it sometimes the results are just that quick. Now, how do you track? How is it that you so much measure success, measure your patient's success? They keep coming into your office, and you start seeing them making progress. What is progress? How do you describe progress with a certain type of conditions?
Well, first of all, progress is subjective. There's no measure.
Okay.
Now, technically, there are scales. How depressed are you, 1 to 10? Were you as depressed last week as you are this week? So there are these kinds of scales, which I don't hold a lot of faith in. It's the way to work with that person. Now, for many people, depression has an underlying anger component. So lifting the anger, getting at the anger, it's irrational. People say things, the relationship is over, or somebody died. How dare they die and leave me? But they don't want to feel that, so they turn it inside and get depressed. So one form of treatment is getting out anger. And as one patient once said to me, you can't be angry and depressed at the same time. So what will happen is, over time, you will see more animation in the way the person talks.
Okay.
They will have less episodes of depression.
Right.
Depression will become less frequent. It will become less debilitating. The person will get back into the world, if you will. They contacted a friend, they re-engaged their job. So you hear it in their voice and you hear it in their words. And you will ask, how have you been feeling? Are you getting better? You might ask questions like that to track it. One of the more common ways of treating depression is called cognitive behavior therapy. And that says that people's thinking causes depression, which then causes maladaptive or abnormal behavior. So if you look at the world negatively, if you look at the world as the glass is half empty, so to speak, you will feel depressed. Or why bother going for that job interview? I'm never going to get it. Now the therapist tries to change the disordered cognitions into more positive. So why aren't you saying, I'm going to go for that job. I'm going to give it my best shot. I feel confident, but I recognize the competition could be stiff, so I'm not going to get it. So therefore, I'm going to feel better. I'm going to be more confident. And then when you start to see the patient talking in more positive statements,
Okay.
when they're more optimistic, when they start to make plans, that's the other way of measuring the success of the treatment.
Now, I think that's a huge thing as far as with being optimistic. That's something that I think that's a big, huge milestone, especially with people who are, with dealing with this kind of condition. That milestone is being optimistic and seeing it and recognizing it, and for them to. But I mean, look, they have to recognize it too, and.
But the therapist has to point it out.
Yeah.
Look what you're thinking. Just step back and look at the hopelessness. And why are you assuming that you're not going to get the job? Why are you assuming that if you ask that girl out, she's going to say no?
There's something I actually want to ask you as well. Being that you've been in this field for 50 plus years, I mean you've accomplished so much. You've done great things, and you've actually stepped. I would say, me personally, I would say you stepped beyond the boundaries of clinical psychology, right? You worked with corporations, you worked with companies, you really kind of went above and beyond certain things. I mean, and really, it probably gave you such a thrill to go outside your normal thing here. But what I really want to know is what drives you? What I mean, there's got to be something about this field. There's something about you that actually just the two come together, and it's just like, man, I just love doing this. I can't see myself. What is it that you find that really gets you?
By the way, that is the feeling. That is the feeling. Like, I love this. I enjoy it. It's very helpful. Now, number one, as a person, I tend to be helpful. I tend to be outgoing. I tend to have always related well to people. So that basis is there. But when you study human psychology and you study the role of the unconscious mind and you look at people's behavior that just doesn't make sense, it incites a curiosity. Why are you failing all your exams in school? Why have you been avoiding relationships for 40 years? Why is the anxiety so great at certain points in time? What's going on inside? So it's people are fascinating, people are inherently unique, people's irrationalities are always jaw-dropping. I will,
Of course.
you know.
Yeah.
So I find that helping people, that getting to know people, that discovering and laying out the irrationalities, their ability to feel better about themselves and to enjoy life more is immensely, immensely gratifying.
Wow, it's amazing. Do you see yourself as a mentor, role model, these sorts of things, or do you really put so much emphasis on it, or is it for you? It's just like a daily thing? It's just something that's just you don't think about. You don't have to think consciously about it. That you really set the bar with certain.
Well, remember, I taught at Nassau Community College full-time for 50 years, and I teach now part-time for the last 3 years.
Correct.
So when you talk about mentor, coach, role model, it has been a marvelous experience for me to have been that to many students. So I'm not their therapist. I've referred many students to therapy, but I have students who became psychologists because they were in my class. I have students who felt that they could relate better to people because of what they learned. So that's been wonderful. In terms of working with patients, it's not so much mentor, it's not so much role model. It's more of getting the patient to understand who and what they are, what are the dynamics at work in their personality, how to make things better. So it's more a relationship, but it's more of what we'll call the doctor-patient relationship, and the person called the patient getting better in the context of understanding and in the context of the ongoing therapy.
Okay. You as a medical professional, what is your intake as far as with acupuncture, Eastern Asian medicine, holistic? Where do you stand upon that?
I'm very, very, very enthusiastic. Now, I would not use it personally in my work because I'm not trained to use it, but I have had many patients, many, who have unexplained physical distress, most notably back pains, stomach pains, chronic headaches. They go to doctors, traditional Western medicine, and the doctors will say, we're not sure why. Don't have a definitive diagnosis. And I have suggested to patients, why don't you try acupuncture? Why don't you try herbs? Why don't you try Eastern? It's something that's unique, it's something that's different, but it's documented that it works. So I thoroughly endorse it. And when patients tell me that they are going to an acupuncturist, I've had patients say, Dr. Katz, is it okay that I'm going to acupuncture while I'm in therapy? I tell them, that's great, you have a 1-2 punch. So I'm very much enthusiastic about it.
That's right, Dr. Katz. Thank you for that. So you heard it here, folks. You heard it right from a medical professional that he endorses, as well as probably many other practitioners in his field, do encourage patients to try acupuncture because, again, it is another approach of getting them better. So I wanted to actually just hit on this real quick. Unfortunately, that's all the time we have. But if you do have time, please go and take a look at Dr. Katz's work on his book, as well as you're on websites, right? Like medical professions, healthprofessions.com.
If someone wants to find me, go to the Psychology Today Therapy website. You'll see my bio, my picture.
I implore you, just go and take a look at his work. Anything you can Google search engine it. It's a lot of fascinating stuff. It really is. I've enjoyed it. I enjoyed him talking. Listen to him talk. I know he does. You also do
I do
Public
consulting
speaking.
work. I do public speaking. I bring psychology. I feel like I've got a certain basic truth, and I want the world to know it and to utilize it and to be better off for it.
Well, we'll certainly get you out there.
Great.
Dr. Katz, unfortunately, this is all the time we have for today. I want to thank you so much for taking the time out and being here. It really does mean a lot to me and also to the viewers as well. So thank you very much.
Chris, a pleasure.
Dr.
Bye-bye
Katz,
now. Good to talk to you.
take care, everybody. Until next time, be well.
The session is over.